Okay, great. I think we can get started now. So, first of all, thank you so much, everybody, for joining this seminar today on targeting COVID-19 relief payments in Bangladesh. It's great to have so many people here joining online from all around the world. I suppose it's kind of good morning for some, good afternoon for others, good evening for others too. My name is Mark Miller. I am the Director of ODI's Development and Public Finance Programme here in London. For those of you who don't know me, I should say I normally look a bit more better kempt than this, but I'm currently a bit fearful of letting anyone near my hair with a pair of scissors. And so this is my lockdown look, I'm afraid. But I'm delighted to be introducing and helping to moderate this event today. And what I should say before I introduce the panelists is I really want to emphasize that this is a jointly produced event. So I'd very much like to thank all our partners with this, the Dhaka Tribune, Bangladesh's Youth Policy Council, the Yale Macmillan Center of South Asian Studies, as well as ODI. And I really welcome the collaboration in preparing for this event. From the perspective of ODI, I'm really delighted to be hosting this, moderating this discussion today. It's the first in a series of events that we're going to be running in coming weeks to look at how specific countries are managing different aspects of the policy response to coronavirus. And I think this is really important because certainly in international media, we're seeing a lot being written about how, say, countries like South Korea have responded to the crisis. But clearly circumstances and resources differ across countries significantly. And so I think the type of discussions we're having today about this very live and tricky policy issue are hugely important, both for vibrant political debate in Bangladesh, but also extremely valuable in promoting lesson learning across countries. And so thank you all to all the participants and people that are joining today. Two just housekeeping issues before we get started. We want this to be a lively debate, not just people talking on the screen. So I would very much encourage you to tweet. We will be using the hashtag C19 responses. So please get on Twitter and tweet about the event. Please also add your comments and questions to the panelists on Dhaka Tribune's Facebook page. And also for those of you in the Zoom room itself, please feel free to pose questions in the chat. Just a second housekeeping issue is for those of you who are in the Zoom room, if you're not, we're not speaking, you can switch, or for non-panelists, you can switch the camera off just to maximize the chances of internet not going down. So let me now move to giving a brief introduction to our excellent panel. I won't go through their full illustrious bios so that we have more time to hear from them. But first of all, we have Anir Chowdhury, who Anir works with A2I and is very much at the heart of providing policy advice to the government on this very topic being discussed today. We have Mushfiq Mobarak, a professor of economics at Yale University. Mushfiq has several ongoing research projects in Bangladesh, among other countries, but has been working very closely with Anir and A2I on this topic we're discussing today. We also have Asif Saleh, the Executive Director of BRAC Bangladesh, an organization who I'm sure you're all familiar with and have a long track record of providing transfers to the ultra poor. We have Sabina Rashid, a medical anthropologist by training, who's a Dean and Professor at the James P. Grant School of Public Health. Sabina's research is highly relevant to thinking about how policies like this might affect the most disadvantaged and marginalized populations. And finally, we have Maria May. Maria is a senior program officer with the Bill and Melinda Gates Foundation. She works on financial services for the poor. Maria worked with BRAC in Bangladesh for 7 years and so knows the country very well. Maria is going to be co-moderating this discussion today, and so I'm going to pass it over to Maria now, who will be able to give a bit of more context to the specific discussions we're going to have. But thank you very much, and very much looking forward to today's discussion.
Thank you, Mark. Good morning, afternoon, evening, depending on where you are. What started as a public health crisis has become a humanitarian crisis, with billions of people worldwide experiencing economic disruptions this year. Prior to COVID, there were about 636 million people living on under $2 a day, with the World Bank estimating that COVID could push another 50 million into extreme poverty. With wide-scale physical distancing policies preventing people from working, cash transfers are a critical policy intervention. They enable those who do not have deep financial reserves to stay home, as well as to offset the risk of hungers and other hardships. By last count, more than 87 countries have announced new cash transfer programs as part of their response to COVID-19, representing over 500 million new recipients of emergency funds. Many of these are short-term in nature, on average less than 3 months, and a common objective is to reach the newly poor population that's not traditionally covered by social protection programs. People like day laborers, construction workers, hawkers, maids, and rickshaw pullers. Many governments are struggling to identify which people or households should receive these emergency cash transfers. The traditional sources of information, such as social registries, tax records, and national household databases, are not comprehensive and up to date everywhere, and many of the newly poor are part of the informal economy. National ID systems may not be well linked to other databases, complicating verification of eligibility. In some cases, governments are turning to private companies that have massive amounts of data about individual behavior, such as mobile network operators, for assistance in identifying the poor. In others, they are working more with local organizations, self-help groups, and religious leaders to tap into deep community networks. There is no perfect approach, and each has many risks and challenges, one of the major ones being who gets left out. To frame our discussion, let me lay out just a few statistics on Bangladesh for those who need it. Bangladesh has an incredible development story with steady GDP growth for decades. About 15% of the population lives on under $2 a day, down from 40% in 1990. However, 85% of the population lives on under $5.50 a day, about 470 taka, and remains quite vulnerable to shocks. Over 90% of the workforce is in the informal economy, which means that there's no easy mechanism to verify their occupation or income, much less provide them with unemployment benefits or income replacement. A rapid assessment done by BIGD and PPRC in April found that 70% of urban slum dwellers reported zero income in the previous week, and 55% of low-income rural households reported the same. Respondents also indicated that they had between 1 to 2 weeks of savings and food in reserve before they would struggle to feed their families. These findings are supported by research on garment workers by MFO and Sanam, which found that over 80% are already cutting back on food consumption, in part of anticipation of hard times ahead. So there's a large-scale need for immediate cash. Prior to COVID, Bangladesh's existing public cash transfer programs covered upwards of 15 million people and came to about $2.3 billion in 2019, including programs targeting the elderly, pregnant and breastfeeding mothers, and children in school. The needs assessment and targeting for most of these programs is led by local government officials and program staff, with a lot of face-to-face interactions. Specifically for emergency COVID cash transfers for the newly vulnerable, Government of Bangladesh plans to provide a 2,500 taka, $30, one-time transfer to 5 million urban households whose main earner has become unemployed because of the shutdown. The beneficiaries of this first disbursement will be identified by the UNOs, district commissioners, and city corporations. If the lockdown is extended and livelihoods continue to be disruptive, these emergency transfers can be continued and expanded. Today, we're going to focus our discussion on one of the most fundamental decisions for the emergency cash transfers, targeting. As mentioned, many families are experiencing economic disruptions, and it's unlikely that there will be enough financial resources to support them all. So what criteria should the government use to determine who gets priority? How will it identify people who qualify quickly, equitably, and reliably? Are there partners, local or global, nonprofit or private, that can help? Just a reminder to all viewers that we really want to make this an interactive discussion. Please feel free to put comments and questions on Zoom or Facebook, or tweet at Yale Rise with hashtag C19 responses at any time, and we'll come back to them. My first question is to Anir Pai. You and the A2I team are deeply involved in the government's planning around emergency cash transfers, and the emerging decisions are no doubt the result of a lot of discussion and debate. It'd be great to get a general sense of these discussions from you, especially related to targeting. What are some of the main challenges that you're concerned about? And what's different about designing this transfer program than the many traditional programs that already exist?
Thank you, Maria. Good morning, good afternoon, good evening, wherever you are. Can you hear me, Maria? Okay. Okay, wonderful. So, so two questions actually here that are important for the government. One is, we've already laid out the extent of social safety net program that we have in Bangladesh, which covers 15 million people in the regular social safety net program and over $2 billion that go into it. So we also have talked about the new poor, the new needy that have emerged, different occupations that have become suddenly needy. They were never part of the traditional social safety net program. So that's a huge challenge for the government. And so extent and targeting, both are issues. So how much money do we need? How much do we give each household? And how do we identify these households? So both are plaguing us within the government. And let me talk about a little bit of the extent. So we've already talked about the $2.3 billion that go into social safety net. So that's been extended by another almost $100 million for the short term. So that's an extension of the existing allowance. And we know who they are. And we have been using national ID for the most part for this population. So 15 million, and then add another couple of million there with the $100 million that are coming in. So we know who they are. We use the national ID to identify them, and money transfer to them for the most part happens through mobile wallets of the mobile financial service accounts that we have, or through agent banking. So agent banking has become popular in the last few years. So these are full service bank agents across the country. We have close to about 8,000 of them. About half of them in union councils using the union digital centers, which we launched about 10 years ago. So they double up as bank agents plus government service delivery agents. So that's the infrastructure that we use, and the mobile financial service agents across the entire country. So that's used for the current beneficiaries. Now, what about the new beneficiaries? How do we find them, and what is the amount that we need? So those are the two important questions. So the first response was to distribute food, about $30 million to about 5 million people. So this was from the food ministry. And when you distribute food, obviously you have to do it in physical terms. So people lined up. Again, social distancing was maintained, was violated. It was a bit of a mix in different districts and sub-districts. And these were identified locally. Again, traditional process. The union nearby officers were the sub-district heads, bureaucratic heads, civil service heads at the sub-district level, about 492 locations, but also done by the local chairman in about 4,500 union councils, which are the lowest level of local government in the country. So that's how this targeting was done, about $30 million. And food distribution has been happening. So this is mostly rice, but it's actually at a subsidized cost that's been given out. Then there is the free food distribution, about $300 million. That's food in the form of rice, wheat, and potentially also other household necessities. And this is where the government became a little creative and tried to buy vegetables locally, because we had a lot of farmers who produced vegetables which were rotting in some parts of the country and where there was a huge scarcity in other parts, and we just could not transport these huge amount of vegetables across the country. So we actually asked the local authorities to buy these vegetables and supplement the food distribution with these vegetables. So that happened again. In some areas, it was done in an orderly fashion. In other areas, it was more difficult. It was really left up to the the maturity and the discipline of the local authority there. So that was also done. And then a special relief that we're now discussing that will start from this month of about 2,500 taka. We will distribute this month and then potentially the next 2 months as well. So about close to about $90 million there. And this is where the task became difficult. Who do we give this out to? So potentially this is targeted to the new needy. So about 12 million people who have left Dhaka because they could not afford the lifestyle there. They were pulling rickshaws, they were selling vegetables and fish on the streets. They were construction workers, they were housemaids. So all these people suddenly became jobless in April, right? Early April, or actually late March to be exact. So there was this subsidy. Now, how do we find them, right? They have left Dhaka, they have gone back to their village home. There is no listing, but there was a target that we needed to give this money to these people before Eid. So especially before the middle of this month. So we tried different types of technologies in different sub-districts and districts, and it became a combination of technology using QR code, national ID, and the good old listing by UNOs and Union Parishad chairman. So it's a combination of things. We have listed about 5 million people. As we speak, 2 million people's NIDs and their names and household information have come into the central database. We have till the 12th when the Honorable Prime Minister will actually inaugurate this to get all this work done. We tried to use some very sophisticated technology with Mushfiq that has not happened yet. Hopefully that will happen in the next month. So next month will be more accurate and we'll figure out who actually needs these subsidies, who needs these 90 million or so. So maybe next month I can give you much more sophisticated answer. So this month, it's a combination of age-old human technology, some QR code, and national ID. Thank you.
Great. Thank you, Anir Pai. That was really helpful. Also to put it in the context of the variety of tools that the government is using to think about how to address vulnerabilities. Mushfiq, I was hoping we could move to you and you could tell us about the work that you are doing with Government of Bangladesh and A2I to combine various data sources, and tell us both about the methods themselves and also why you think they hold so much promise in this moment of COVID.
Yeah, thank you, Maria, and thanks everybody for participating, especially those in Dhaka joining in. I know many of you are, it's right after Iftar and maybe before prayers, and thank you for spending your time with us. And you know, the problem we have right now, as already was clear from Anir Bhai's comments, it's a very, very complex problem. Because, you know, you have new categories of poor who are coming up. People, like, we have to really both do vertical and horizontal expansion of our system, where we, you know, bring in more and more people into the relief system. And, you know, we've had lots of, in the newspapers, you see lots of discussion and debate around social distancing, should we be opening factories or not, etc. Right? And I have to say, the panelists on this, in this room right now, so Asif Bhai, Anir Bhai, and I all probably have slightly different views on the extent of social distancing we should pursue. But one thing that we don't disagree on, in spite of the fact that we disagree on a lot of other things, is that we need to get relief in the hands of poor people very, very quickly. People are hurting and they need support, right? And this is not a uniquely Bangladeshi problem. We are, you know, the methods I'll talk about, we are also working with the government of Nigeria, where partly because of the oil crisis, you know, it's even more of a problem there. And they're already seeing sort of civil conflicts emerging. And you're also seeing protests emerging in Bangladesh. So it's important that we get this right. Right? And to handle that complexity, I think we do need to bring in multiple methods and sources, right, to do as best as we can. And before I describe the method, I should say, look, we have to also acknowledge the fact that everybody's uncertain about things. This is a new crisis. This is a complex problem, right? So whatever we do, we might not get it perfect. Right? And part of the reason for us to hold this webinar right now and maybe have more conversations over the next month is that we do want to engage with the citizens of our country We want to engage with other experts from different fields. We want to get feedback, and we want to make sure that we use all of the ideas that are on the table. We check all the boxes that people may be concerned about. Okay, so with that said, so the first step, I think, in thinking about relief distribution, we have to first think about exactly who should we be targeting. And that's where some research, some data, some expertise can help, right? So Anir already pointed out, there are traditional poor people. There are poor, ultra poor, Daridro, Hotodaridro. We have to be targeting them. We have to help them, right? And an important reason is that, look, if you don't help them, they're not, even if you want to impose social distancing, they're not going to be able to maintain your guidelines if their children are going hungry, right? And another category that Anir mentioned that's a little bit more difficult is the new poor, so people who are suffering the most during this crisis period, right? So this is separate from poor. This is who are the people who face the largest shocks, largest decrease in their income earning opportunities, right? And yet another group that Anir Bhai's comments alluded to are people who are moving around, right? So urban laborers, right? And that's a uniquely important group because we know how the virus spreads. It spreads from human to human transmission, right? And we already have data that shows that communities where there are recent migrant returnees, right? They're 2.5 times as likely to report in our surveys that they have COVID symptoms, right? We also see, the quarantines, the distress calls, the testing that we're seeing not only in Bangladesh but in other countries, in Philippines, in Indonesia. It correlates quite well with migrants moving around, and that means we have to be very careful about the fact that these are people who might be spreading the disease, and therefore we might want to target them and make sure that they don't move around, that they're not as desperate to move around, things like migrant laborers. So part of actually what we are able to offer through data and analysis is pretty simple. We just think through conceptually who should be targeted, and also use our data that we are collecting right now through phone surveys, as well as data that we have from the past few years on occupations, to just help us think carefully through these are the high target groups that should be prioritized. Right? And then now getting into the complexity, okay, how do we identify people who are in these groups, right? Because they're new, it's not that we have existing databases. And again, that's a problem that's not unique to Bangladesh, right? Many low and middle income countries don't have the existing infrastructure present. Yeah? And so to do that, like the trick that, the insight that we are trying to make use of is that while the government doesn't have complete information about who falls in these groups, researchers don't either, BRAC doesn't either, right? There's one technology that people do carry around in their pocket that's closest to being universal in Bangladesh, and these are mobile phones, right? And so here I have to give credit to the mobile service providers in Bangladesh. They're very technically very sophisticated. So we've learned a lot in the past few weeks around the sophistication of Robi, around Grameenphone, Banglalink, and they've already been cooperating with the government to provide very, very useful data, information, and services that we need for this crisis, right? And so if we get to cooperate with them, then maybe we can get information about who's where and what they're doing. And how is that useful? So, well, the simple way to explain this is that, researchers like me, we've been collecting lots of survey data in the past few years. So for a subsample of people, small pockets of people in many different upajilas around the country, we have very good information on who are the poor, who are the non-poor, right? Who are the people who are in occupations that we should be targeting, that are more deserving of support right now versus not, right? So we have this information. Now, if we can merge this information with the really impressive data that telcos have maintained databases, right? Then what you can do is look at how are the cell phone usage patterns of the poor and the non-poor different, right? Are there usage patterns that distinguishes one group from the other, right? And there might be very subtle differences in usage pattern. It won't surprise any of you to know. So the people who are logging in to watch this, right? We are all in a relatively privileged position, right? And we probably use our cell phones differently than poor people do. So you can imagine how much SMS we send versus calls we make, right? How many people we call, right? How big our network is, right? All of those things are very, very different for poor and non-poor, right? And so the idea here, and we are trying to use the state-of-the-art technologies that have been developed around the world and published in in universities like Harvard, Yale, Stanford, UC Berkeley, and then published in the top scientific journals in the world, right? To try and create a system where we identify using the telco's impressive data sets, can we indirectly infer who is likely to be hurting during this time based on their cell phone usage pattern. Okay, because if you can develop that algorithm, if you can develop the matching process, then you can easily apply it, maybe not easily, but you can apply it to the entire population who have cell phone services. Now, the final thing I'll say is that this procedure has a lot of advantages, right? Traditional ways of targeting are slow because you need to create lists, you need to have interviews, you need to do surveys, right? And we don't have the luxury of being slow right now. Given how fast the virus moves, we need to move fast as well, right? And it also has advantages in terms of being low cost. So if it turns out that 100 million or more people have cell phones, then we can use the cell phone based strategy, right? Then we can quickly reach lots and lots of people, right? And we can do it at low cost rather than doing many, many, many surveys, right? And asking many questions and deploying many people around the country, right? And especially during a social distancing period, that's important. But it also has disadvantages, right? So for example, we cannot just leave it up to a model or a machine to make all these decisions for us, right? The machine is going to make mistakes, just like humans make mistakes, right? There's going to be what we call inclusion errors. People who shouldn't get support, maybe their names will come up. Exclusion errors, even more important, people who should receive support, maybe we're not identifying them, right? And so it's important for us to not just leave it up to the machine, but to develop an amalgam system where we also have human touches. So here's a simple example. So the machine can tell us, oh no, here are the people who are very high likelihood of support, almost definitely need support. Here are people who have medium likelihood of support, right? So for the medium likelihood, we don't want to just say, okay, let's not go there. Maybe what we should do then is send out an SMS. So these are the technical capacities, thankfully, that A2I, Anir and his team have developed, and BRAC also can deploy, right? We will send out SMS messages and ask people saying, it looks like you might need support based on what we know, right? And can you answer these 3 questions on SMS, right? Or call this number, because we want to bring in the human touch and make sure that we fill in the gaps that are being missed, right? So I think ultimately it will have to be a system where we make use of all different sources of information, both human as well as modeling.
Great, thank you, Mushfiq. Really exciting, and have a few follow-up questions for you to come back to. So high tech, low touch, let's go to the complete opposite extreme of super high touch, sometimes very low tech. Asif, BRAC is, I think, known well worldwide for its ultra poor graduation program, and a big part of that has been the targeting methodology that helps identify kind of the most vulnerable. I know that BRAC has also been doing some of its own cash transfers, and so I hoped you could tell us a little bit about the direct support you're providing around cash transfers now, and also what lessons in targeting you think BRAC could offer to the government and A2I as they think through how to identify the newly poor. I think you're on mute.
Great. Thank you, Maria. Yeah, you're absolutely right. Our ultra programming is very low tech, and but it fundamentally puts that inherent faith in the community that they know who are the poorest within the community, and then they select them, and then that's followed up with BRAC's sort of bench strength and capacity and a scientific way of verifying whether they are really the poorest in the village. So the process is designed in a way that the community has the ownership in the targeting process, and at the same time, there's complete transparency on how it is done, so that there is no question about why certain people are getting it and some don't, some don't. Within a community where they probably are in very similar sort of poverty trajectory, right? But again, this can be done in a peacetime, as Mushfiq was saying, development process. I say peacetime because I think we are in wartime right now, because this is a crisis of epic proportion, and speed is of essence right now. So we don't have those luxury anymore. So this time, I think what we are seeing outside is that there were already a problem of exclusion in the existing system. I mean, the existing system is extremely fragmented. And I'll come to that a little bit. But at the same time, as both Anir and Mushfiq have said, that, there's, and our research has shown all these new poor have come in. They're not part of any list, right? So how do we get to them? So on one hand, people were hearing that government is allocating all these thousands of metric tons of rice and others. And then on the other hand, you had protests and you had people like, where is my portion, right? So clearly was a mismatch. So the option in the initial stages was to either create a very, very wide sort of net so that everybody gets covered and there might be some error and somebody may get more than what they deserve, but or to create a very, very sophisticated system, perhaps like what Mushfiq is saying. So I think in the initial stage, the crisis was to sustain people, right? In a sense, so we probably missed a trick there in terms of not widening the net bigger in a much bigger way than we did. But having said that, we also understand that we are a very resource-constrained country. While it can do it for short term, I mean, this crisis is unlikely to go away. And so in a sense, the economic shutdown may get lifted very soon. However, I mean, the new normal is not gonna get the economy back up to speed in full capacity. It's probably 50 to 70% capacity the economy would be functioning. Of course, there will be joblessness and all that. That's coming up in the horizon. So we will need a sophisticated system eventually to keep this flow of support ongoing to the old poor, to the new poor, all for a good amount of time going forward, at least looking at next 18-month horizon. So while we support in the short term, we need to also think about building that plane as we are flying as well. So hence we are also thinking around what to do in terms of where to go. And we evolved also throughout the process. When we started first first of all, when we started our support, we first determined that we're not going with food, we are going with cash, because at this time market is functioning, so cash is king. And so we went with sort of 100,000, we targeted 100,000 households. We determined an amount of 1,500 taka to, which is gonna sustain about a 4-member family for 2 weeks. And then we depended on our own lists. And here also there was an interesting learning that in the urban space, I believe that while in the rural space, you get a lot more credible lists, people are more rooted. In the urban space, when we went with our existing databases and we found that a lot of people who were in their database who we categorized as daily laborers and who are don't have monthly wages, which was our target group, we found a good amount of people who have moved already to the village. So here, the learning was that rural-urban connection in the social safety net protection needs to be very much well established. Here, so because they were displaced or they moved as soon as the general holiday was announced, moved to their villages, they were lost from our system as well. So we missed a trick there. And hence we had to go back and verify physically and all that. And we depended mostly on cash transfer, where 3 members of our team actually went to their household because of the social distancing issues and provided the cash to them. So then the second round, when we went with another 100,000 families after 1 week, we basically thought that giving cash is risky, number one, and number two, it was also not as speedy as possible because people were hungry, people were skipping meals. So we needed to get to them as fast as possible. So we said that, okay, let's start to think around cashless transfer and mobile financial service. But our first worry was that, are we gonna create new exclusion based on whether people have phones or not? So we did a very quick survey in 4 different regions of the country to see among the ultra poor population, how many people actually have mobile phones, how many people have bKash accounts and bKash MFS account, and such and such forth. So we saw that interestingly that about 37% of the ultra poor had phone. But then we asked a second question: do you have somebody you trust within your family or neighborhood to whom we can send the money, and somebody who has a bKash account? So when we asked that question, that number went up to 84%. So that, and the remaining 16%, basically we had to give cash. So that we initially, in the second phase, we tried, then expanded that to 6,000 families. And our results was that 94% of the people, of those 6,000, actually got the money without any problem at speed. And then the remaining 6% had some issue around, numbers not being right, or there were issues with their inactive accounts and stuff. But we got that resolved over time as well. Then we started our third phase where we were much more confident. And at that time, we were basically saying that when people know that mobile money is the way to get support, they figure out a way to quickly register with the mobile financial accounts. And we were able to register people in droves, in thousands and stuff. So in our third phase, where we additionally targeted 100,000 people, we could do 80% of our transfer in cashless way. Much convenient for everybody, not only for us, but at the same time for the people who are receiving the money as well. So that was a very interesting learning that, and then since then what we have done, our offices can't do any collection or transfer for microfinances, but a lot of people are coming to withdraw their savings from microfinances. So we also could register almost 200,000 people in a very quick amount of time with their bKash accounts and transferred over 100 crore worth of their savings within a very short span of time. So this is giving us a lot of confidence about digitization going forward. And a separate sort of experiment that we are going to be starting with Mushfiq's team, and also work in support with support from World Food Program, is the element that Mushfiq explained, where there will be an element of algorithm testing based on airtime usage of poor people's behaviors, in terms of how the poor people actually use their phone, and create an algorithm on that. But we will also have a mechanism of ground truthing how much of that is accurate. So there will be field forces over there to verify at the same time, at least at the initial phase, to get our comfort level and a higher level. And the third thing that we are doing is a self-reporting mechanism that we want to set up, where people who are not in any list, but who are basically saying that I'm a new poor, but I'm not in a list, but I deserve relief, they can call in, and then we have some way of verifying using technology and some level of ground truthing. So they should be eligible to get that relief. And the third group, which is becoming more and more prominent, is a group based on geolocation specification, which are basically groups where COVID is getting confirmed within a household family, and then the entire community is getting locked down, right? Because of stopping the spread. So this is a group which are also getting very badly affected because they're not getting any support from outside. Can't go outside either. So we are also targeting this group. So these are the three targeting that we want to do in the next phase that we are doing with World Food Program. And hopefully we will have enough learning there with help from Mushfiq and others that can set up a model going forward. As I was saying, that we will need a sophisticated model going forward for a good amount of time in terms of how we do transfers and targeting. Thank you.
Great, thank you, Asif. And I think what you're saying too, I mean, every speaker so far has talked about people moving around and the fact that we can't really classify these people as urban and these people as rural. It's not that simple. And so if the phone is going everywhere with someone, and especially given that you can actually move money to somebody's phone, it just points out kind of how powerful this technology and these tools can be. Sabina, I wanted to turn to you. A theme that's also come up, I think, in every speaker so far is that of exclusion, both the risk that there was existing exclusion in the system that could be exacerbated during this time, as well as the possibility that the methods that we choose could introduce new types of exclusion. And I'd love for you to just tell us, listening to these speakers and in the research you're doing, what strikes you? What are your concerns about the vulnerabilities we may be missing?
Hi. Oh, sorry. Is it me or Asif? Because I just dropped for a minute.
It's you, Sabina.
Okay, hi, because my electricity keeps going. Sorry, guys. So I thought it was very interesting because we're really dealing with a crisis, a humanitarian crisis. And I agree with Asif and Mobarak. It's good to hear that we're looking at high technology with the human touch, because if we don't actually have that community-centric approach, we lose something along the way. And I'm at there's a new poor, and then there's the existing poverty that exists in the country. And one of the realities is, as the pandemic unfolds, but beyond and before, pre-COVID-19, you had existing poverty in groups that are already marginalized. And so I would go for a more inclusive approach. I'm not the decision maker. I do field work. I've been working with urban slums and rural areas. But I think a couple of thoughts I had, which was, we're trying to be as effective as possible. When I hear, Anir Bhai and Asif and Mushfiq and all these groups, there's so much thought behind how do we design this carefully so we can really address the most marginalized, the poorest. And then I go through this thought of when I was, working in my PhD, which was a long time ago, and then I continue to work in urban slums. I find, it's fluid, and that's the scary thing. When you have a baseline that's weak and fragile, the movement to go lower and the movement to slightly upgrade, or what we say, you've improved in your poverty or your levels of kind of income, is so fragile within these groups. And I would think an inclusive approach would be important, because within these groups there's like disabled. I mean, if you look at, we just finished a national representative sample of disabled populations in the country. And it's very interesting. It's very hard to locate them. And we relied on what Anir Bhai was saying, local networks, trusted groups, when we could go home to home and ask them, who is the person who's disabled? Because there's a lot of false reporting. At the same time, we found at this level that, there's two categories. You either are a disabled person with XYZ, or you're a family member with a child who's disabled. But if you have a child that's under 6, it is not counted as a disabled family. So, these are some of the nuances. And then we talk to these, which undertaking some case studies now. Some of these disabled groups talk about caregivers who are neighbors, who used to bring food for them, who used to buy things for them. They've lost that kind of support. You've got people who are talking about transport. They said, even if things open up, before I could go in a rickshaw to my workplace, but given the transport is shut down, I'm even doubly marginalized. You've got transgender groups, and there's been a lot of news reporting other than some of our research, where familiar locality and you're bullied, you refuse the carrier of the virus. So I think there's a lot of, as I think Mushfiq said it, and I think he's probably an anthropologist at heart, and BRAC always dealing with this sort of three-pronged strategy. These are very complex issues. And we need to bear in mind, though, in these existing groups, there's further marginalization going on and further panic and fear. And one thing I realize is that many people don't have access to mobile financial services. They don't understand digital wallets. They don't understand the mechanisms. They don't understand what it means. And the poorer, the less literate you are, it's sort of a very scary experience. I struggle with Zoom. I mean, you can imagine someone in a village or in a rural area struggling with accessing something that they're being told. So if we want to increase numbers, I think a national circular sharing what the plan is very, very important to say, this is the services that will be available. This is the kind of money that's going to be given. There's a lot of behavioral studies that show that when people are under a lot of pressure, stress, particularly double stress in humanitarian crisis in poor countries, you go into a mode of cognitive scarcity, which is, it's not that you don't know how to make decisions, you're just confused and overwhelmed with the decisions. So if we're looking at a rollout of money that's going to be given over a period of time, I think it's very important to think through how much money and over what period of time, or at least around the first round. And this is where the human touch comes in. After the first round, do some rapid assessments, conversations with different communities. We have enough databases through BRAC, through many, many organizations. Government meets many NGOs, there's many, many organizations, and have some quick conversations. How was the transfer used? How did it work? What was the confusion? What was the struggles? Because I really believe in that cash transfer. If you don't give clear, simple messages, there's room for rumors. Rumors is what started the whole stigma. Rumors start disruption in social networks. Every community relies on each other in different ways. In our urban slum studies, we found poorer neighbors turn to slightly better off landlords for food, for loans, for borrowing the rickshaw. So I think it's very important that whatever we do, we don't disrupt already stressed out networks that are at breaking point. And I think that what I would suggest is that if we do this sort of approach, there's Dalit communities I didn't mention, beggars are on the list, there's, of course, female-headed households, et cetera, et cetera. I think that we need to leverage what we have. We have in our history during disaster management, administrative systems that manage, we have some of the best sort of effective disaster management responses. Can we go back to some traditional with the high tech, with the human touch? Because I think we've really got some great opportunities with the reach. I would also suggest that messaging is very important contextually. And I think Mushfiq touched upon this, because depending on how the government rolls out the cash transfers, it may be different. So it might be in certain geographical locations, you give more. In certain parts, you give less over time. In certain places where there's more widows or there's more sex workers or transgender communities, we rethink the approach. But the messaging is not just about, it's about giving those who are the most vulnerable the ability to spend wisely. If we don't know how long this pandemic is going to continue, we don't know how long the shutdown is going to be sustained, we may open up. Let's say infections go up. Let's say they don't. But if infections go up, we're going to have shutdown again. Maybe. I don't know. So the people who are getting the cash transfer, and the intentions are for them to manage in this economic crisis, social crisis, it's very important they get information. Simple messaging over the phone, because everyone has a phone in their pocket. And if they hear that, I think it'll resonate much more. And we have surveys already that discuss what they're prioritizing, how much money is being spent on income, what is the stress levels they're going under. If we can incorporate that in the messaging, it allows for communities to actually work better together and effectively. Along with, banks and other systems that need to be in place. We need to remember, and I think all of us are converted in this audience and probably in the wider audience, that money doesn't always allow access. We know with many in the Dalit community, various forms of discrimination exist. We know with sex workers, we know with disabled people. We just did this national survey, we're doing case studies. And I think it may be refined over time, but here's an opportunity to have a look at a universal, so from a human dimension, because poverty, as I've seen, and maybe from my ethnographies, it's fluid. I met leaders in slums that became poor overnight when the slum was evicted. I met people who had, one little grocery store and suddenly they had their kids going to school. So we need to remember, yes, there's a new poor and they're very important, but this is a very fluid category and it's a fragile category. So with Asif, I agree, we need to be as inclusive as possible. Yes, some may get it who don't need it, but rather some get it who don't need it than miss out on those who are really, really vulnerable. So these are a couple of my sort of comments. The contextualizing, the contextual messaging, asking communities themselves, that involves them in the design, because ultimately they are the main stakeholder. Everything that we're discussing today is for them. And I think it's really important that everyone here is doing research either for them or the service delivery is for them. And I found through my research, the right kind of communication can dispel many, many issues at this level. So even cash transfer, there can be a lot of confusion and there can be a lot of trouble making. And sometimes, I just want to add one more point in our social networks. So you don't also want to have, because many families, people with more social capital, phone works and support. So we have to manage some of those relationships for them. Ultimately, they're the most they will be the beneficiaries, but the most with the least voice and power. Yeah. Thank you.
Thank you, Sabina Appa. A lot of really important dimensions that I exist in the experience that may be hard to see from outside, that are fundamental in terms of thinking through how to design these programs. Anir Pai, we're sort of making an assumption here that the mobile companies would be willing to share their data for these purposes. And so I wondered if you could talk a little bit about how you're already working with the MNOs in the COVID response, and then specifically, do you think that there's a willingness to make the data available to the government, to researchers like Mushfiq, that would enable us to even to do this practically? And I think you're on mute.
Okay. Can you hear me now? Okay. So when we had the first COVID death on 8th of March, we realized that we had one testing center in the country, which is the Institute of Epidemiology, IDCR, which was able to do only a few hundred tests a day. And we didn't know how the number would increase. And we now know, I mean, after maybe a couple of months, we now know how the number is increasing. I got a call from the Department General of Health, Director General of Health, that whether there is any other way of tracking high-risk cases. So the obvious one is to do the high-touch approach of doing testing, PCR testing. So collect samples, bring it to the lab and do the testing, and then take a few hours or maybe a day to get the results and then report back to the community, to the person. So we thought that maybe we could set up a self-reporting system so that people could potentially call in or provide information through some kind of technology. So we looked at the web. Most people don't have access to the web, and if they do, they can't actually do all this complicated data entry. We looked at potentially USSD, which was used to do money transfer at one point before the advent of apps. Still is being done by people who carry not smartphones, feature phones. About 60% of the country still carry feature phones. So we looked at USSD, and the one that won out in that whole discussion was IVR, interactive voice response. People would call in. There is a voice that would come in and say, press this if you have shortness of breath, press that if you have fever, and all of that. So we actually set that up, and that was quite successful. I won't say phenomenally successful, but it has given us very, very useful information. And that was done by the 4 telcos. So I sat down with all 4 CEOs, and they immediately decided to help, come forward. So we set up the IVR system, the 333 helpline that was used for the last 2 years to provide information on a host of government services, such as passports, land record, birth registration. But this time we actually repurposed it to report COVID symptoms. And this has collected so much information in the last 7 weeks. About 5 million people called in, and we have a wealth of information. And that is now allowing us to identify high-risk cases and also high-risk zones, the hot zones, as we call them, before even testing is done. So we decided about a month ago that why not repurpose it again to have people call in for food. So since then, we also repurposed it for food calls or relief calls. We've received about 400,000 calls so far, and we have tested them. So we basically, when the calls come in, the calls go to a human operator. Again, through a triage process, they have to answer some questions, then the system logs those questions, and then throws the call into a human operator. The human operator then asks further questions to verify, and we have so far forwarded about 100,000 of those 400,000 calls, so about 25% of them who we consider deserving. Again, a combination of technology and human touch, which is verifying who the most needy are. So this is a use of very simple technology, just feature phones, no smartphone business here. Feature phones, which are allowing the people who are excluded, who we can't find. So this is one example of that. The use of the human beings to verify is very important. We use that for the COVID calls. We use that for the food and relief calls as well. So for the COVID calls, the ones that we consider, the algorithms consider high risk, we have actually, so all 4 telcos have developed their own kind of filtering mechanism. So they've looked at how people call in, how many times they've called, whether they called the week before, the panic calls. So they have all kinds of very sophisticated pattern matching of how people make calls. And they figured out a way to screen the most high-risk cases. And then those high-risk cases then go to human verifiers, as we call them. So these are doctors and medical interns who then make thousands of calls every day to find out whether the high-risk cases are really high-risk, whether they have become better since they have called, whether it's a prank call, or whether it's misinformation, misreporting, all of that. So again, the combination of technology, low technology, and the combination of high technology, which is use of these very sophisticated algorithms. So we use low technology for making calls, technology that's in the hands of people. We use high technology, very sophisticated ones, artificial intelligence, to filter things based on patterns, and then human verifiers who then make the final call, final decision about who deserving people are. And then the human verifier information is again fed back into the sophisticated algorithms, because the algorithms keep learning. So algorithms make better and better decisions over time. So that's the process that's going on. And that's working better than before. That's finding the people who are excluded. The traditional listing process is not finding them. They're self-reporting. They'd rather call into a phone and get that information over the phone rather than going to a person in broad daylight and say, I need food or I need relief. So that's also the social stigma that's being somewhat addressed to that. Now, one thing that we have not talked about, and that will have to come up, is that listing is ultimately a political process. So we may look at the social dimension of it. So BRAC could go door to door, or we could send people from door to door to find people. People can do self-reporting through technology. But at the end of the day, there is a very dominant political decision that also decides who gets listed and who does not. So how we weave that into this sophisticated targeting process, the community-focused targeting process or technology-driven targeting process, we have to still figure that out, because if we bypass the political system completely, then it will not be accepted. So how we accept algorithms, how we accept decisions of algorithms, I think will have to be tied into that political process of listing. I think that's something to keep in mind. We don't have a solution right now, but it is something to keep in mind and to keep in consideration of all the design that we go through, design that's driven by technology, design that's informed by human beings. So political information has to be factored in. There is a couple of other things that I'd like to bring out. So obviously, the money that we collect from the government and distribute to the needy, to the new needy and the old needy, new poor and the old poor, may not be enough. We don't know how long this problem will persist, how long this food and cash subsidy or the mobile financial account subsidy will be needed. So that's where we're now exploring the possibility of crowdfunding. And BRAC is involved in the process. We had been toying with the technology in the last few months, where we were looking at micro investments for SDG financing. So financing a hospital, financing a bridge, financing a diagnostic center, financing a skills development center, which will actually generate income. And so we were looking at micro investors from the communities who would put in, let's say, 10 taka every day or 100 taka every week, and would become an investor into these profit-generating projects for SDG financing. So essentially, we're looking at that. We developed the technology, but suddenly SDGs became COVID. So we don't talk about SDG at all. We now talk about COVID. The last 2 months, I don't think I've heard SDG mentioned too many times. COVID multiple times in a sentence. So it's a dramatic shift that has happened. So now we are saying for community financing, so not financing, for community relief, can communities also come through? So it's the month of Zakat. So we mobilize about over $3 billion in Zakat every year, much of which happens during the month of Ramadan. So we're expecting that with this technology, which has not been launched, it will be launched in the next few days, we will actually collect a large amount of Zakat and donations that would also contribute to the large sum that's going in the form of cash transfer, the cash benefits transfer. So BRAC is a partner in that whole effort. Bidyananda is a partner. Rohi Mahfouz with its Zakat Fund is a partner. Islamic Foundation is a partner. Bangladesh Scouts, with its about 2 million volunteers, is a partner. So it's a multi-sectoral effort to see if crowdfunding finally works. One last thing I'd like to mention to a question that Sabina mentioned about the financial literacy of the poor to use these technologies. So obviously, Maria, you will remember that in November when we had the wages summit, digital wages summit with Better Than Cash Alliance and BGMEA, we looked at about maybe 40% of the garment workers receiving electronic payment. And we were having a discussion with Rubana Appa whether we could set a target of 90% till 2021. So we said that, okay, another 2 years, 90% is that achievable? And she said, okay, maybe, maybe not. But we, I think, still set it. It's suddenly become 100%. So in the first 2 weeks of April, about 25 lakhs, so 2.5 million garment workers suddenly had digital wallets through bKash and Rocket and Nogod and the others. So this was actually created in bulk. So we got NIDs for most of the workers. Many of them did not have NIDs. So, and there was no time to create NIDs that quickly. So we used their birth registration number as an alternative for the time being. And they will hopefully get NIDs soon. So all these new 2.5 million garment workers now have mobile wallets, mobile accounts. So how to use them, I think, will be determined by the ability for them to go to a cash out point, because they don't always use their phones to get the money out. They actually go to a cash out point. And since we have about 900,000 cash out points across the country, many agent banking points as well. So I don't think it will be a difficult thing, because we have seen the experience of the elderly and the widows and the persons with disability who have been getting social safety nets in the last 1.5 years through mobile financial services. So I think it is a problem that we don't have to worry about too much. There obviously will be some, but I think by and large, it's a solved problem. So I think that can be adopted.
Great. Thank you, Anir Pai. I'm going to ask the others to try to keep their responses short, because I want to have a lot of time for the questions from the audience. There's a lot coming through already. And this is just a reminder to everybody out there, if you have a question, please make sure you either put it on the Facebook or Zoom chat or tweet at Yale is using the hashtag C19 responses. Mushfiq, again, I know we don't have a lot of time, but one of the specific potential places where we might see is from the gender divide that we see in phone ownership. And so the latest numbers we have are that about 7% of men have phones, only 67% of women. Curious how you would address these sort of things if we move towards more of a digitally oriented approach.
Yeah, so as we discussed earlier, definitely there are going to be lots of exclusion risks that we need to pay special attention to, and gender is certainly up there as one of the most important dimensions. And there are others that Sabina mentioned as well. And I think okay, so I'll give you a technical answer first, but then I'll broaden it. The technical answer is that, like, the advantages of using this kind of data analytics-based approach is that you can test what you're doing and how it works. So for example, in order to implement this approach, remember I said that we have to merge in data from the mobile service providers, which is an important input, along with survey data where we have the ground truth information also, right? And that ground truth information includes things like gender and other aspects of people's disadvantages, right? And so once we have a model, and let me try to simplify the thing and say, imagine that we have 15,000 households on whom we have the ground truth information. We can divide that up into, let's run the model and train the machine learning algorithm on only 11,000 of them. And then we leave 4,000 as a testing area, right? So we see what kind of predictions the machine makes. We see what it would do for those 4,000. And then we can compare it to the reality to see how well it's doing, right? So there you can, intuitively, what you can identify are things like, oh, is it that systematically women are less likely to be picked up, right? Or any other group that you care about. So one can test and then adjust the algorithm in order to fill in the gaps in the system, right? So that's a general approach that we will take, and in the interest of time, I won't go into more detail, right? And Sabina also mentioned, that messaging is going to be very important, right? And here we've already thought through, there's not only this machine learning thing, there's also sort of a behavioral science component of all of this. So for example, in the work we're doing in Nigeria, the vice president's office there wants us to add some kind of conditionality, right? So you can imagine, when you send money to people, you can, and their phone number, you can send an SMS and saying, look, this is money to support you so that you can stay at home, so that you don't have to, you can maintain social distancing more easily, right? And we can add a soft conditionality on that. And then once you do that, you can also send SMS messages back to them saying, reminder, it's like, look, it looks like you're moving around, or like, I'm not giving you specific answers here, but whatever it is that the government and the civil society is comfortable with and want to do, the technology does permit this, right? And another set of issues is about privacy concerns, and I'm sure that's going to come up. I'm sure it has already in the questions. And we are trying to set up a system such that there's data merging happening, where survey teams from Innovations for Poverty Action, they own some of the data, and then the mobile service provides some of the data. We're putting that together, and we're asking computer scientists to process it, and we're putting in a system so that no single institution or entity has access to all the information, and everybody has the minimum amount of information with personal identifiable indicators erased, right? So that we can maintain data privacy as much as possible. And finally, let me just say one thing that came from Anir. I have to give him credit for this, right? So when we were discussing this and setting up the system, Anir's thing was, hey, you've been saying to me, and it was embarrassing for me, you've been telling us about like running experiments and randomized control trials all these years, right? Why don't we set this up as a trial on a trial basis? I was like, yes, that idea should have come from me. So what we plan to do is not to take an entirely new system that's untested and roll it out nationwide all at once. What we would like to do is maybe pick 50 upajila where we try this out, and then we have other 50 as a comparison point where we do the traditional method, right? And then as soon as you do that, you can start collecting data on how are people reacting. We can do this in the same places where we're doing our phone surveys, so that it's easy to quickly collect data. And the following week, we can report back, how do people feel under this new system? Are they happy? Are they content? Do they feel like there's mistargeting, right? We can also collect data directly on food security to see if the system in objective terms is working as well or not. And then on the basis of that evidence, then we can choose to move forward. And as Sabina mentioned, at that point, in those same places where we run these experiments, we can also add a much more hands-on anthropological approach to data collection. Right? And this is what's wonderful about webinars and like this, is that we make these new connections. And I mean, every opportunity I get every hour these days, I'm trying to make connections and learn more and see what we can do next. So.
That's great. To all the academic institutions out there, I think Mushfiq gets like an honorary PhD in anthropology, and Nearby gets one in economics. There's like a lot of great learning going on. Sabina, Appa, I wanted to stay. You're on mute, Appa. I wanted to stay on the topic of gender and women's empowerment. There's a lot of research from across the world showing that directing cash transfers to the women in the household results in more financial control, as well as women's economic empowerment. And this is something that actually the Bangladesh government has done historically with its education stipend and other programs. In this moment of crisis, we're seeing the conversation shift much more towards getting the money to the household and less specificity on who. And I just, if you think that, again, in the midst of crisis, when speed is a priority, should we care? Should we really be thinking about that? And how do we balance the need for equity and speed? And you need to unmute yourself, Appa.
In principle, I wouldn't say I'm very reassured, because it's good to know there's been so much sort of progress made in terms of accessing mobile financial services. I think, in principle, you want to put gender equity first, but from a human social justice perspective, this is large-scale poverty. This is hunger. This is large-scale poverty. And many of these men and women live together. It's not like a man opposing a woman. If you look at the BRAC recent study, there's been a lot of violence in the households because of hunger. We just finished a rapid survey of 3,000 households where it's a huge percentage are talking about worries about the family. And women talk about the family, men talked about finances. So from a social perspective, men are the rice winners. So really they're worried about their emasculation and alienation and further marginalization, if you put that in that place. I'm not justifying the violence. You look at women who are already, particularly those who tend to be marginalized, are much more fearful about the future of their relationships. We came across stories of, if you don't have money, you don't have food to eat, how will a marriage or a household stay together? So if we start with the unit of it's a household, and we don't have the technology to pinpoint every woman and how do we target that, I think we need to be as inclusive as much as possible, because the idea is to get cash there to help support. Having said that, this is a novel concept, I believe, in the history of our country. So for many people, the fact that it's being done for the first time, what is their perception of this? Because it might be addressed. So that's why I said at the beginning in my last sort of round of speaking, very important to be very clear what the rollout looks like. Because if there is a lack of clarity, we don't also want the men to turn towards the women and say, where's the next lot of money and why isn't it coming? So it's very clear for men and women to be in this together. And along with the messaging that goes to these groups, our lives are interconnected with our spouses, our extended families. It is the same in villages and communities and urban slums. Much more fragile, but it's the same. I would say here's a great opportunity to affirm women's role in managing households well, through TV, media, posters, because it helps women when they see these messaging, because women are great leaders within the household. They're also great leaders outside the household, but the patriarchal or the structural factors have made them believe they're not necessarily leaders outside in the public spaces, right? I would also say, when we send this money, and if we later on refine it, as Mushfiq Bhai and Asif and others were saying, when we talk to it's very important to have sort of gender neutral messaging about the family, having a family, a smaller family means, happy, healthier lives. So rather than, pitch women against men where there's already this fragmentation, it's about having men and women come together, but empowering women through some other means. It could be as I said, television, the phones. It gives them confidence. It also reinforces, the interesting thing about human behavior is we learn from each other. So I was noticing in Dhaka and Gulshan and other places, some people started leaving their homes. Other people seeing them started going out in their cars. More people started using rickshaws. Same thing in slums. Some people actually now venturing outside their locality. And then when there was the initial enforcement, people didn't. So learned behavior and learning takes a while. So if men get that reinforcement in every household, together you two can decide. I mean, I can't come up with a nuanced message right now, but I think you can come up with a very simple, very targeted message. Men get that information. Women are empowered, and women are also building their own skills. And I think this is very important for this cash transfer, to affirm certain positive messages. Another thing that I think is very important, and I'll shut up after this, I promise, is the whole thing about we need to talk about stigma and discrimination. Whatever we do in whichever form, because there are ethnic minorities, there are Dalits, there are people with disabilities, there are sex workers, there are beggars. We have a social hierarchy, and we're not caste conscious, we're class conscious. So even within slums and villages, there's a very strong class hierarchy. And I think some of that about this is affecting everyone. And we need to come together as communities to help each other would be very useful, because that actually addresses the gender dimension. And then, as I said earlier, when you talk to the communities about how the responses are, their feedback, you kind of start involving that kind of in your refinement of the program. But I think these things are very critical, because many things don't resonate if it's not contextualized. And then we complain they're not compliant. So we're not speaking their language, and they know their lives best. So thank you.
Thanks, Sabina. Asif Bhai, last questions to you from me. Again, everybody has laid out that the seemingly impossible task where hard decisions will have to be made with very imperfect tools and information. How is the role for BRAC in supporting the government? Are there ways that you can support them in their targeting decisions, or is the role more feedback or complementary programs? Just to take a step back and say, it's not just the government that's solving the problems. As Anir said, there's a role for business, there's a role for NGOs. Would love some reflections from you on that.
Thank you. No, absolutely. I cannot build an alternative system. We have to support the government in terms of better targeting. So that is what we can do, and where Anir mentioned that this is, at the end of the day, also a very political process. We are seeing a lot more willingness from the political leaders to engage with us, because at the end of the day, no politicians want riots in the street. And that's what we are facing. If people don't get food, they're going to be out there. Not only they're not going to be defining the social distances, but they're going to be rioting. We have had news of rickshaw pullers actually completely taking over DC's office in Rangpur in protesting that lack of relief and stuff. So those are going to get magnified if we don't target the right way. And that's where organizations like ours can come to government assistance, not only to help build that trust in the system for the community, and at the same time target people reaching the last mile, the most vulnerable, who the government can't reach. The entire system is currently based on political leaders knowing various segments of the system on their network, and people who they think deserve to be in the system, right? So that's got to change at some capacity. What we're heartened about is that, there are some initiatives that have started in Dhaka right now. We have a pilot going under the LGRD ministry, where in 7 of the municipality wards, we have committees set up, where headed by the political sort of representative, the councillor, but with the member secretary being a civil society member, and also some of the very senior members of the community coming up jointly with a list together. And that's the ground truthing that I was talking about, that, if we have a list which is acceptable for political and non-political leaders, we have probably not going to get to 100% accuracy, but then probably 80% accuracy. And then if we start linking some level of algorithm in there to kind of validate some of these listings, we can probably get to that. But still, you would have people who are excluded, and that's where organizations need to come together. And I want to make one point very clear, that this is a crisis where there's no way the government is going to be able to handle this together. They're going to be needing a wide spectrum of different types of stakeholders to come together in this with their strength. And Anir was exactly right, that they're setting up all these community donations, community level, sort of bringing in the scouts. We have army helping the civil administrations. We have NGOs. We are now building booths for sample testing. We have doctors, our doctors in the government line. So there's a lot of different kinds of partnerships that are getting set up. But Bangladesh has some fantastic examples of successfully managing crises, and those are both short-term and long-term. You mentioned, Maria, disaster management, but there are also, you have written a book on how we tackle TB, where there was social stigma, there was a similar type of communicable disease, where there were a lot of things we did right, which became a model for model for the world. And then we had fantastic example on hand washing and water, and also in terms of building latrines, where we changed community behaviors. What was common in all three, in TB, washing, and disaster management, is the community was at the center of it. You can't keep the community in their house just by giving administrative orders. You have to convince them, they have to own it, they have to also own the solution themselves, and that's when change is going to happen. So do we like it or not, we're going to live with COVID for at least another 2 to 3 years. We have to involve the community in the solution. Thank you.
Great, thank you so much. I'm going to pass it over to Mark to ask some of the questions that are coming in from the group.
Great, thank you. And it's an enormously rich set of questions on Facebook that unfortunately I won't have time to do full justice to, because we've got just 10 minutes remaining. But I'm going to pick out kind of 3 areas of questions that I think are particularly pertinent and recurring. and ask the panelists to give quick responses to their questions of their choice. So the first one is that there's lots of questions in respect to, I suppose, a debate around the value of targeting versus a more universal approach. And some of the questions raise some challenges around this kind of sophisticated targeting. It takes time. There are some concerns around, are we trying to be too clever and almost over-identifying a group affected? Some questions around, how effective or confident can we really be that some methods will effectively identify this group of new poor? And so is there a case actually for perhaps providing smaller amounts but going for a more universal approach? So I think that's one group of questions. I think a second group of questions relates to concerns around privacy, and particularly concerns around how we can be sure that data won't be stored or used for ill motives, for political purposes. So perhaps the panelists might want to talk about whether there's any checks or balances that could be effectively put in place to mitigate those concerns. And I think a third area that comes up in the questions, there's a recognition that technology can obviously be useful and helpful, but government policies to access technology then matter. And so one question that's raised on Facebook is, if technology such as mobile is used to reach those in need, will the government go out of their, relax registration policies for SIMs and things like this, so that exclusion from access to technology is reduced? So I think those are that's a very, very brief overview of the main questions coming through. So I suggest that panelists give themselves one last minute to take the question of their choice. Perhaps Maria can then sum up in the sort of final 2 to 3 minutes everything she's heard, and then I'll say a final word. So Anir, actually let's go in reverse order. So Sabina, why don't you start? And
You're
I'm
on
going
mute.
to stick with 1 minute. 1 minute each.
Inclusive approach, because the vast majority, there's a marginalized, already marginalized, there's the very new poor. Go for it. I want 1 point in 1 minute. I think it's very in the future of a universal basic.
We're actually struggling to hear you a bit there, I'm afraid, Sabina. So I'm going to go on to Asif. Just 1 minute, please.
Yeah. So I want to take the third one. I think it's very important, the connectivity issue that you mentioned, that about policies for accessing. And this is something, Anir knows very well, that when I was at A2I, I really also worked on this issue, that this is something that now needs to get into a high gear, that, as this, just like the RMG wage mechanism, this is, everybody is getting fast-tracked into providing services digitally, including ourselves. We are now doing this more than ever, but the connectivity is a big barrier. So how do we provide low-cost, affordable services? That's going to be a big challenge, and we need to think creatively here. That how do we create free Wi-Fi spots, access, all of these things where people can access these services equitably. Second point, very quickly, is universal income. I think it all depends in providing universal support to everyone, blanket support. It all depends on how much we have in the kitty. In a sense, it all depends on prioritization of the government. And I, for one, would be, in absence of a sophisticated system, would definitely prefer that everybody has a small amount that we can actually give everybody, because right now that what we are doing is not a solution at all. But then whether there is ability or sustainability element to sustain this for the long term is going to be a big question for a country like ours. Thank you.
Great, thank you. Mushfiq?
Okay, so I'll talk about targeting. I mean, it's a very good question and good concern about whether, you know, we should not worry about targeting, maybe we should do universal distribution, right? But my conversations with both our government counterparts as well as with BRAC, who's along with World Food Program, is setting up some form of distribution, is that universal targeting has its deficiencies as well. You know, we just simply don't have enough money to give money to everybody, right? We need to understand who to target. But on the other hand, we're gonna use common sense. So for example, in a purely urban area, like where you can look at where people live, like if they're in a bosti, you know, they need support, right? In areas where the neighborhood identity is enough, you don't want to use a sophisticated method that takes time or takes effort, right? You just want to spatially target. If you identify there are some occupations that need support at this particular time, right? Just on the basis of their occupational indicator, you can target. And importantly, we're not asking the government to hold back any kind of relief activities for this new system to come in place, right? What we're doing is, you know, first round, you know, our system won't be in place. We need to get money out. Let's do it the traditional way, right? By the second round, we'll have extra information available. Let's see how we can maybe supplement your information with the new strategies in order to improve like a method that's an amalgam of the human method as well as the like a technical method.
Great, thank you, Mushfiq. Anir?
Let me start with the policy question. Two quick examples. Bangladesh Bank, which for valid reasons is quite careful about new policies, new regulation, decided in a quick phone call that it would allow a birth registration number to be a verifier for new accounts. And that's how 2.5 million garment worker mobile financial accounts were created. Today in the cabinet, it was decided that virtual courts would proceed. We've been discussing about whether we could use video conferencing in a room of, in the courtroom for 3-4 years, and we did not get an answer. Today it was decided in one meeting in the cabinet that it would go on, that we would use virtual video conferencing and no courtroom actually. So lawyers would actually be sitting in their homes, judges in their homes, and they would actually have a conversation about specific legal decisions using video conferencing and using this e-filing system that we have rolled out in 9,000 offices, but not in courts. So that's the speed of decision-making that happens in the policy realm in wartime, not in peacetime. So we could see many new advances and innovations there. Let me just end on the privacy note. So we are being very careful. I mean, this is an important area. So we have to make sure by even international standards, the telcos who are sharing their confidential information, we have to make sure we work in a very secure environment. We're using the National Telecom Monitoring Center's secure environment to do a lot of these computations. So hopefully we will not breach any kind of privacy, whether we share data with researchers, whether we share data with data scientists, it's all being anonymized, and we're making sure that no privacy information is leaked. But having said that, I will also cite one example of a conference that I attended about 2 years ago in Bangalore, organized by CGAP. And it was discussed the highest concern for service provision in Western countries and in the sort of the southern countries, Africa and Asia. The highest concern for use of technology was quality of service in the Western countries. Was private. Southern countries in Africa and Asia, it was actually service. So privacy was a secondary concern. So I think we also have to keep that in mind. I'm not suggesting that we overlook privacy concerns, but the service concerns are first and foremost. Thank you.
Thank you. Let me just let Maria, do you want to then sum up? Then Mushfiq will have just a final thank you, and then we'll also, I will also say one last thing, and then we can close.
Perfect. Well, thank you all for a great conversation. You know, lot of great ideas that we could have spent a lot more time on. In summary, a few of the thoughts that I'll be today. One, I think just to reiterate that when we're thinking about targeting and cash programs, it has to be our ultimate concern. People need money yesterday, if we're honest. There's a huge upside to looking at mobile technology, both in terms of targeting as well as maybe delivery. It's not without risks, but I think it would be, somewhat short-sighted to take advantage of the new tools that we have available to us. That being said, these programs have to be designed in a very contextual way, recognizing the dynamic environment in which they're set in, and the realities on who's vulnerable today may be very different from now. Even if we high tech it, everyone keeps saying that high human element is crucial. And so we may need about ways to do that are appropriate in the context, but we can't leave out this human element. We want a system that works well. This also, again, is at the end of the day around the people, citizens who are receiving these funds. And so there are political dimensions, but there's a huge need for transparency, very good communication to kind of look across the country, and through some of the risks around privacy, the need for feedback from the community level, and kind of who's well positioned to provide those different things. The government can't do this alone, so the need for huge ongoing support from companies, NGOs, communities themselves. I've seen that historically in responding to disaster in Bangladesh, that people come together and really help one another. So again, really being true to that tradition, thinking about how to leverage that so that no one gets left behind. And then lastly, like as Anir was saying, last November, I don't think either of us thought that 2 million garment workers counts by now, that there are these opportunities to make great progress, whether that's in financial inclusion, that's in thinking through databases and new systems to support cash transfers going forward, enabling policies of more digital development, and then also the readiness to change social norms. So how can we combat stigma? How can we really affirm the women as wealth managers in the household? The ways to really, again, embrace a position that's been given to us. So I really want to thank the panelists on my behalf. It's been a pleasure to moderate this conversation. And I guess I'll pass it over to Mushfiq for a few specific thank you.
Yeah, before Mushfiq comes in, perhaps just also thank the panelists, thank everyone for joining online as well. Just to say, please continue to add any comments on Facebook. We will continue to look at them. This is an ongoing discussion. There will also be future events being hosted by ODI on similar topics. So thank you very much. And Mushfiq, over to you.
Oh, yes. So just to say, thanks very much, Maria and Mark, for all the work you put in to organize and guide the discussion. It's really important that we have discussions like this because the work that we're doing, we're doing it fast, and so we need quick reactions from the community. Thanks to Dhaka Tribune, Zafar Sobhan, for helping make this happen. And then at Yale, there were a few people who worked on the technical aspects. So Ryan Martinez, Rifayat Mahbub, Kasturi Gupta. And then at the Gates Foundation, Seth Gars helped put us all together. And the work itself that we were describing wouldn't be possible without the cooperation of the major telecom service providers in the country, Grameenphone and Robi. Their senior leadership team have been extremely supportive. And then Youth Policy Forum is another institution that has allowed us to connect with young people in Bangladesh. And we hope to have more conversations like this, and I hope you'll join.
Thanks very much.
Thank you very much.
Thanks very much, everyone.